policy. It's
So
just
I'm not gonna comment though on a medical, because I'm not a physician, but I have two outstanding physicians up here who I'm gonna have connect with you to discuss that. And
You
go
made
through
that decision though.
So, at the recommendation
Not my doctor.
of physicians. But we'll talk with you about it, absolutely, because I can understand and appreciate your concern. Thank you for that. All right, I said, yes, sir.
Yes, you've had 20 plus positions terminated because of freezes and stuff. Are those 20 plus still terminated, or any have any of those didn't destroy?
So two separate actions. The federal government, all federal agencies were placed on a hiring freeze upon the entry of the new administration. So that is separate from the terminations of probationary employees. So we had 118 occupations that were exempt from the hiring freeze, that we're still able to hire and bring on those staff. Physicians, nurses, therapists, psychologists, we're still able to bring those folks on. The probationary terminations, those individuals typically serve less than a year within the federal government, or 2 years if they were a different occupation. Those positions are still no longer employees with us. However, we have submitted for exceptions or a request to bring those folks back. We've not received the determination of our request at this time.
They're still terminated.
At this point.
Are you able to hire right now?
Yeah, most occupations that we have, not all, but most occupations that we have. So we're, excuse me, we're still bringing on certain employees. So again, those that do direct patient care for the most part are not subject to that hiring freeze.
So I think I get excellent care from the VA here, and I appreciate
Thank you.
that. But I'm concerned about we having the adequate resources, not just physicians, but other people that are valuable, that you get those positions restored. I think it's been quite detrimental to the system for you to have lost positions.
True,
You should be gaining positions, not losing positions.
And we have a group of new employees who are actually starting Monday. We're still bringing staff on. We're still bringing staff on that are going to be able to provide service to our veterans. And we will do what we need to do to make sure that veterans' health care and services are not interrupted and not impacted.
I want to ask Ken.
Yes, sir.
I want to make sure I understood you correctly.
Yes, sir.
I go to the vet center on Friday night.
Okay.
I have a therapist there, I have a group session, I'm there twice a week. Is it any cause at all for them to worry about her positions being shut down or canceled or terminated or anything like that, or do you even have?
That's a great question. I'm with the Veterans Benefits Administration. The vet center is a separate piece. I have not seen their jobs, whether they're exempt or not exempted, but I would just say since they're direct counselors, I would say that would be limited if they do. But I don't have that information directly to say that. The counseling I'm talking about is people in what we call our Veteran Readiness and Employment section, or vocational rehabilitation is the old name for it, where we provide direct case management counseling, get veterans in school, follow them through the school process, help pay subsistence allowance, help pay for their school. Those are the counselors I'm talking
Years
about.
ago, I was.
Great, that's great. Yeah, and we find them jobs too.
Yeah.
So it's a great program. Yes, sir. Thank you for your question.
I just was asked to ask this question.
Yes, sir.
Because
I know this is the vet
I
center.
know a vet that goes there.
Yes, sir. Yeah, I'm familiar with them. I have lunch all the time with John, who's being at the vet center, John Whitlock. But I have not heard officially anything about that. Yes, sir.
Thank you.
Yes, ma'am. I have a question. This current administration, they're cutting and cutting and cutting. How are they expecting you to meet your benchmarks on patient care, on all the care, when they're losing everyone for you?
So just to make sure folks understand the perspective, we are still able to hire staff. We are still going to have staff that we need to provide essential services to our veterans. So we're not talking situations where we have mass numbers of staff that have been cut, or that I project probably will be cut. We're here to fulfill our mission. We're here to make sure that we provide healthcare treatment and services to you all. This is your facility. Now, may we possibly need to do things a little bit differently? Maybe. It's too early in the process to really tell if we need to do that, but we will absolutely be here. And we will absolutely make sure that we're providing you the healthcare that you've earned and the healthcare that you deserve.
Thank you.
Absolutely.
And are you speaking for all VA hospitals?
I'm just speaking for Salem. Absolutely.
I want to thank you all first of all for the health care getting here. I'm super impressed and pleased with the quality of fast health care getting here. But only one full question for getting, and I look back and the legislators that came in, they're gone. And I don't see them.
Yeah.
I don't see them. It's a shame because all these questions they should hopefully keep notes down on them. All these priority, concern, and compassion you have and ask those questions. They should be here.
So we did meet with the congressional staff folks right before this meeting, and so we had that opportunity to dialogue with them.
Not us.
But we didn't.
Yeah.
That they came and before you could say anything, question number one, they were gone.
Yeah.
Amen.
Especially since a lot of them are not taking emails, phone calls, town halls, they're not.
And we'll be happy if you have specific things that you would like us to pass on to
We would
them.
like to do it.
Well, absolutely, we can write that down, and we have contact information.
I know about that. You've done great healthcare here, and I appreciate you and your staff. Thank you again.
Appreciate
But
it.
what a missed opportunity.
And I just wanted to add too, as a patient here, I had nothing but great experiences with all of the staff and providers, and access for the things I needed have been outstanding. And so I just wanted to pass on or say for the record, like I was heartbroken this morning. Sorry, when I read that the VA is planning on cutting 83,000 more positions.
That's all the question.
Sorry. But
That's what I wanna
don't
ask.
believe or understand how they cannot negatively impact healthcare or benefits by firing 83,000 more people on top of the 2,500 they've already cut. And also would like to pass on my concern about the PACT Act protections, because I've also read some things. Project 2025 says, in regards to benefits, that we should no longer provide disability benefits related to presumptive conditions from Agent Orange and burn pit exposures that are currently protected under the PACT Act. So I just want to say that I hope that all of our representatives will continue to advocate for the VA and for us, and I know the Vietnam veterans fought for decades to get those Agent Orange protections. And so I really, really hope that our representatives will continue to speak up for us and advocate for us, and for the PACT Act in particular.
The ones that aren't here.
Thank you for the
Thank you.
feedback on the.
Woo! Woo! The accent one.
You have my commitment that we will do whatever we need to do to make sure that we can provide you that great care. And I sometimes joke that I wish I had a crystal ball to see what was coming. We don't have that, but the commitment is not gonna change from our staff, from our facility, from our community-based outpatient clinics, to make sure that we continue to provide you the very best that we can. And to speculate what may happen in the future, I wanna focus on what we're doing here today, but I appreciate it.
Since you volunteered to speak to the congressman,
Yes.
representatives, I would ask that you would share with you what it would do to you to lose positions. This 83,000 or 85,000, whatever that number is, but the VA cannot afford to lose positions. And all the congressmen need to hear that, from the people who are affected, not only the citizens, the veterans, but for the people who have to administer the health care.
And who makes the decisions on who's gonna be cut? I mean,
Elon
anyone
Musk.
doing
Yeah.
due diligence Are they just taking a hatchet and chopping things?
Chainsaw.
You know?
Right now, the VA is in the first phase, which is determining the plans. So they're outlining the plans and talking about what the plans may be. And again, we're talking what I call big VA. So not just the medical centers, not just the regional offices, but the cabinet level department. Right? When you see some of those figures, that's for all big VA, not just, impacts at the local level. But the agency head, which is the Secretary of VA, if you read the actual process for reductions in force, is the one who determines the plans. Those discussions have just started, and so there will be opportunity for us in the field, to engage and take a look at what those plans are. To reassure you, I'm fairly confident that feedback has gotten.
I was at the client's office yesterday, and the staff wouldn't even talk to us. So, there you're in a conundrum, But is that gonna be transparent, when we know ahead of time?
I'm not sure. I would be guessing, so I don't wanna speculate
It's not good
on
that people have to
that.
guess when it comes to their health care. My husband's been going to VA for years, and to think that that's gonna be cut down in some sense. Even when people do the ordering and different things like that, you may not consider it health care, but it will impact the patients.
And again, I think that, we may need to do things a little differently in how we do things, but you have my commitment that we're gonna continue to be here. Okay, we're gonna continue to provide you the highest quality care that we can, absolutely.
And one thing I'll add to that, on the benefits side, I have not seen anything regarding the PAC network or any rollback of that whatsoever. We're actually trying to expand it, just expanded in August of last year again, and we'll continue to as far as we see. And as far as from staffing thing, we think all of our staff are critical, just as Ms. Stackhouse has said. So regardless, I know we talked about a couple of key positions we have in the Veterans Benefits Administration, but all of our positions are critical. So we're doing what we can to voice our concern about that and fight for reconsiderations.
Hi, my name's Bridget Kelly. I bring a 83-year-old vet from Rockbridge County here to this hospital for his services. And I talked to him about the cuts and what work is like here now. And he said, it used to be really bad. It was hard to get an appointment. It took a long, long time. And this was prior to the PACT Act. He said, it's good now. I can get in. It's, I don't see anybody not working. And you yourself said that it used to be 70 some days for the special doctors, and you're trying to get that down. And how can you do that when staff's being cut? I heard on the news coming in that the Veterans Administration has pledged to take the staffing levels prior to the PACT Act.
So thank you for the question, thank you for the feedback, that we've gotten better, that makes me feel good.
But are we gonna go back?
Yeah, the staff that we've seen impacted thus far are not direct patient care staff. And the ones that are seeing our veterans, providing the active treatment.
But 2,400 versus,
Yeah,
85,000.
Right, across the entire United States, U.S. territory, so big VA, you're talking an organization that has, 470-some thousand employees. Right, so not just Salem VA, so when you hear those numbers, again, putting it in that perspective, that when the secretary says, we're gonna take a look at, he's talking the entire department, the entire cabinet level department. So again,
But that's 18% of the staff you said you currently had. 85,000 is 18% of what you just said you currently have.
right, around
So 20% of the staff you're gonna cut, and you're gonna believe that you're gonna keep the care up?
We are gonna do everything possible to
Good luck.
make sure that that happens.
All right.
Absolutely. Again, I don't wanna speculate, I don't want to predict, what the future is going to be. Maybe we have to make some changes to some things and how we do some things, perhaps. But I don't know. I don't know what the impact is going to be with us, but I do know that my commitment, my resolve remains very, very strong. And we have great staff here. We have extremely dedicated, committed staff.
Yes, you do. Keep 'em.
Already saying that they're already short-staffed. Every nurse that I talk to says, man, we're running around like crazy because we're short-staffed already. Like, this is last year, you were short-staffed.
Yeah.
According to nurses and doctors.
There are some challenges with some occupations. You know, nursing is one. We've made great strides. Bringing nurses on, and bringing primary care physicians and primary care providers on. A year ago, we had several vacancies. We're almost, I think, fully staffed at this point in primary care. You're always going to have those periods where you have pockets of vacancies. People retire, people move to Idaho for personal reasons, different things that happen. So you're constantly going to be in that state of recruitment. And again, with some exceptions, more administrative type positions, we are able to continue to hire. We're able to continue to bring on those staff that are responsible for providing that direct patient care.
You said you had some positions that were removed because of the directive. Given, if you had authority to choose, would you have removed those positions by your own decision, or would you have added positions to meet the goals that you're talking about?
Yeah, thank you for putting me on the spot. Given my choice, right?
Your choice.
Our staffing would not change. Our staffing would not change. Because we have brought on staff who we feel we need to effectively run the facility. Doesn't mean we can't run the facility effectively without those staff. We just have to change a few things, but again, hopefully that the veteran does not experience. They happen behind the scenes. Yes, ma'am.
Hi, so I actually have this, I know that you had mentioned, that the people who were let go were not in direct, contact with patients. However, I spoke with 2 recreational therapists who were fired, who do work hands-on with, patients. So I was wondering if I'm incorrect about that, and
The majority of the probationary employees who were terminated were not in direct patient care.
Right.
Not all. There were a couple that were not on the exemption list.
okay, and so, I mean, now that they're gone, is it, because they had told me there's only like 1 person for this one entire floor, is it just going to be a lot more hectic there, or are people not gonna get as much care?
So we have some resources within recreation therapy that we're able to provide the essential services. But are things going to be a little bit different? Sure.
I would just share feedback that I think you need to share with those above you. Is that when government employees are being termed as not nice names, that makes it hard for you to recruit people when federal employees are bad by the present Congress and present administration. So I think it would be helpful for you to feedback to those above you that makes your life harder to recruit people, harder to keep people. And I think that feedback needs to occur from the public, but also from those who have to hire people who hear things like that.
Thank you for your feedback. Appreciate that.
I just want to say, I get real good care here,
Thank you.
and I appreciate that. And we just have to wait and see how stuff shifts out, and Congressman Griffin met with about, well, he came down to Bedford in Franklin County and said, veterans, what do you all need? Not that many people showed up, but he does want to help the veterans, and he has empathy for our situation, and I'm glad for that.
Thoughts and
And I
prayers.
volunteered up there for 3.5 years they say serving coffee and tea and cookies to the veterans and the, civilians. And if you wanna see what goes on up here and see how good it is, just volunteer up here. Whether it's the Red Cross or whoever that's doing, you can find out, check with the staff house and find out. And you can come up here and volunteer, and you'll find out what goes on. And I did not even know what palliative was until I volunteered up here. I found out how to spell it and what it was, and they get very good treatment. So, I just will say that I appreciate the treatment I get here, and I think you all do a good job, and I thank you.
Appreciate that.
And I'm just curious, could you cover a little bit about what the probationary jobs were, what some of the titles were? What is probationary?
So probationary typically means that the employee was in the position or a federal employee for less than 1 year. There are some positions, mainly clinical positions, physician nurses, that the probationary period is 2 years. So the folks that were in that round of probationary terminations were employees, again, that either were in the job less than 1 year, federal employees for less than 1 year, or that 2 year time frame.
But isn't it true that sometimes when you're switching between different divisions of the government, that even though you've served a long time, that you become probationary? So like,
There are limited circumstances where that could be the case. If I'm a non-supervisory employee and I move into a supervisory position, there is a new supervisory probationary period. There were errors throughout the country that happened on the lists of those probationary employees, and that's where agencies had the opportunity to go in and say, that's not correct, this is not a probationary employee.
and what kind of jobs here in Salem were probationary
With
that
the
got fired?
exception of the two recreation therapists, they were administrative positions.
Okay. Thank you.
Being very patient.
Everybody, because first started with 2.5 years, also retired from the Boston, I got civilian experience. And the new administration wants to run the country as a business. I've been involved in a lot of layoffs. And a lot of layoffs look good on paper, but they wind up saying, oh, this manpower is wrong. So they add back manpower here and there. One question is, do you foresee that happening? And another question, and another change that needs to be made is rec therapy, music therapy, it needs to fall under the psychiatry umbrella for future, because us with PTSD and mental illnesses use that a lot, and we learn that a lot for care. It ain't just going out fishing, it's learning hobbies and stuff to cope with outside of away if you're by yourself and stuff like that.
Absolutely. In my background, where I started in the VA, I'm a recreation therapist. That's my background. I wouldn't begin to speculate on layoffs or risks, again, not knowing what may happen in the future. And our recreation therapists, our music therapists right now are organizationally aligned under our physical medicine and rehabilitation service. So along with our physical therapists, occupational therapists, and then to create some of that professional cohesion. I appreciate that feedback.
The follow-up question is, I know the rec therapy, music therapy is mandated up here. As far as what umbrella it falls under, is that mandated higher, or is that local?
No, that's a local
So
determination.
you could feasibly put your committee together and put it under.
Yeah.
That's
We can take a
what-
look at that, absolutely.
This is a suggestion. You know, up here, they're not doing committees and looking at stuff, they're just cut just like a business. If you could, in your committee, could you look at it, please?
Yes, absolutely.
I have two questions, if I may. First question is, I know the staff and all you said you have today, that may not be tomorrow or the next day, especially once you mentioned the 83,000 throughout the VA that we take away. My question is, if that occurs and your staff gets low, are these veterans going to know, and I'll be aware, that they can go to outside providers and that it will be covered
Yes.
through the VA reimbursing for the outside hospital?
Right, so our community care program will continue to remain. And actually, the VA has partnered with the community to provide care since its inception. Because the VA can't provide everything that's necessary, but yes, we will communicate well in advance if there are going to be significant changes to the healthcare provision. Absolutely, we're going to do that.
With my husband, you had to go through a process to get approved and have to wait.
Correct.
And if the staff is cut and they're backed up, they can go on to these doctors and not wait a month to find out if you're going to approve them to see another doctor.
So they still need to meet the eligibility requirements for community care. I've not gotten any indication that those are going to change. But if there's going to be, again, a significant shift,
Yes.
we absolutely are going to communicate that ahead of time.
Because I would anticipate a high volume wanting to go to outside facilities if you're cut short. So that was my concern to them. And then my other question is, since the representatives and congressmen kind of just, your heads ran out of here, can the veterans ask the VA on their behalf to set up a meeting in this place and that they attend to answer questions for these veterans? Or would we need to get a petition for you to get that to happen? Because we run around everywhere and they're hiding, no one comes out. And these veterans want to have them there instead of them having to run everywhere to find them.
So if veterans are interested in holding a meeting or having an event here, absolutely, we can work with them to make sure that the space is available, and we have the setup for that, like we're doing for the Vietnam veteran event.
So can you request them to come?
I can pass the communication on that there is significant interest, and that we can make our space available.
Will we contact you for that?
Hmm?
Will we contact you for
Yeah,
that?
we can give you contact information after, sure. That microphone.
You talking about going outside, I'll share this with you, they found that I had AMD up here and also at Vistar at the same time. But they let me go to Vistar because it's 45 minutes closer to me than to be there. But they found it here and at Vistar at the same time, and they let me go out there, so, and I appreciate that.
But the time for approval,
And-
staff starts going away, are these patients gonna get to doctors in time? That's my concern.
And could you just clarify how many people have actually been fired here in Salem?
So I'm not comfortable in talking about that number because it was not a large number, and I want to respect their privacy.
Yes, this is more of like a benefits related question. I've had a lot of veterans talking to me about payments getting late, especially like veterans using GI Bill. Is this kind of a like sign to come, that a lot of payments are going to be late?
Right, I'm not seeing payments being late. If there's a specific thing, we need to look into that, but I've not heard of any type of delay in benefits being paid, because on the education side, you have what's called enrollment certification that goes into the school. And as long as you're enrolled, say from September till May, and the certification is done electronically, it should come, just like clockwork. It should not be an issue.
Well, I know some of this has been raised recently, in the last couple of weeks. Whether it's disability payments not getting on time or like housing allowance from education benefits. So it feels like it's a more recent thing. That people who have been getting it steadily with no issue, now there's for some reason an issue.
I'd like to, if they are, they need to contact our 800 number, 1-800-827-1000. That's our main number that I was talking about earlier. And they need to look into that and see if it's a case by case or if there's something going on with the payment system, which I have not heard of that. We would have seen that by now. We would have gotten mass communication saying there's a delay in the processing of a payment, and I have not seen that. Thank you.
Hi, Joe. I know earlier you were talking about, there was a question asked about how a permanent employee was let go during his fire. I know you said it's kind of big VA who has kind of the strategy that's coming into place. And when I did get a chance to talk to one of those employees that were, unfortunately fired, they gave me a document that said the Office of Personal Management was the one that kind of led to that decision. Can you kind of just give a little bit of clarification as to either is that them making the decision or they telling you, hey, we got to let some people go? Because I just got.
Thank you for the question. Office of Personnel Management is gonna, the federal government's big HR arm. They're communicating down from that big HR arm to VA. And say, here are the staff that have been identified, on the probationary list to be terminated.
Gotcha. And then kind of an extension that you talked about the strategies, like, you know, big VA. Can you kind of, is there a way that you guys know about how they're determining that, what the plan is, or strategy that they're talking about?
So we've not received communication yet in terms of the plan. Again, I think it's in the very initial conversation, discussion period of that. Typically what happens is, once plans are identified, then that will be communicated down regionally and then to the local level. But we've not received any of that communication at this time.
Thank you.
I want to piggyback on that, just to make sure I'm aware. So, did they let you guys know who to let go, or is that like an internal decision between the Salem VA Medical Center?
So for the people that were terminated to date, no,
Yes.
that was not a local decision.
Okay. So it's one of those things that they let you know, hey, these people have to go, and then you guys kind of send off that information.
I think communication was directly sent, to those individuals.
So you guys had nothing to do with, I mean, the choosing anything like that?
No. We were not involved in that round of the decision making.
I was just wondering, I've heard a lot about, staff, nurses, and, therapists, and people like that, has been like that, and, I was just wondering, will there always be, jobs open for in mental health? Cause I ain't heard nothing about any mental health, positions.
Sure, mental health positions at this time are exempt from like the hiring freeze and that. If I had my crystal ball, I would say yes, we were gonna always have positions available in
Does that
mental health.
include counselors and, other staff for, mental health?
We're still hiring for all those folks.
I've been coming up here for 30-some years, and, if it wasn't for mental health here, I wouldn't be here. Plus, the medical side too.
We're still hiring for, social workers, psychologists, psychiatrists, peer support counselors, all those folks, yep, we're still actively hiring.
I'm sure we can. We know that other VAs and staff here and the,
Your regular brain cookie.
Yeah.
That always works. I wanna comment on her comment. The reason she's getting the care she's getting is because the people here at the Salem VA really care about veterans. Yes. They're working scared to death, because they don't know if they're next, but they're still doing their job, and that's awesome. You've got to be an excellent leader.
Well, thank you. It's the team that makes it easy. It's the team that comes every day and again,
You know
really
it's
knows
here.
that we're here.
Were these cuts from the Doge agency or whatever?
I don't have that exact information. Any other questions?
What kind of cookie?
You gotta have a little levity somewhere.
And again, follow up with, but again, if you have individual benefits, case questions, medical questions, we'd like to talk with you. But thank you, everyone.